Hi, everyone. Welcome to Mama Wears Athleisure. I am your host, Mariela de Santiago, a first-time mom. We focus on all things mom with tips to help make life easier and more organized for all you mamas out there. Hi, everyone. Today I am here with Hana from Chart Your Cycle, and we're going to talk a little bit about postpartum birth control and the spacing of children.
Hi, thanks so much for having me. I'm Hana, Chart Your Cycle, and my business is all about helping women learn how to chart their cycles using the Fertility Awareness Method. So that's charting cervical fluid and basal body temperature to identify exactly when you're fertile. So you can use that for birth control or to help you conceive. And I also just help women make informed decisions, use true informed consent when choosing what birth control method is best for them.
So I'm just going to go ahead and jump right into it. What's
Yeah.
important to know about postpartum birth control? And I think that this is kind of a question that we don't really talk about very often within like our mom friends, but it's
Mm-hmm.
something that you probably think about a lot because oftentimes you might hear of a friend that became pregnant, maybe not wanting to, but they were breastfeeding, or there's always these stories that you hear.
Yes. Yeah. So that definitely about the breastfeeding part, just debunking that myth. That's so important to know postpartum. I feel like that's getting more mainstream that breastfeeding does not protect you from getting pregnant. And so you do need to choose some sort of method that works for you. A little bit about my story. I think that I planned my first pregnancy. I felt really fortunate for that. But after having my baby, it was the pandemic, it was 2020. I moved internationally when my baby was 9 months old, and then I moved again when he was two. And I needed to have a method that worked, and I needed that time. And so I think what's important to know postpartum about birth control is having a plan and of what you're going to use, and then also being open. I was thankful I was open handed about my timeline. I didn't feel like I want my kids exactly 2 years apart. I feel like that's really popular to have a spacing in mind, which is totally cool if that's what you want. But I was just really more focused on what my family needed. And that was a lot to move twice with a baby under two and the pandemic. So I needed some more time between my kids.
I love that you mentioned that because, yes, in theory, it sounds so nice to be able to like plan it all out. And I want my kids to be X amount of years apart and whatnot. And I thought after 1 year, after my son turned one, that I would be like, okay, I think I'm ready. And now I'm like, oh my gosh, I think I need him to like be in preschool because I need a little time for myself before
Mm-hmm,
I
mm-hmm.
dive straight into baby number two. So I'm glad that you mentioned like it's really what is kind of personalized for each family and like what works for them given their situation.
Yeah, and not comparing to what other families are doing or that reality of that age pressure of like I'm getting older, like I already had my first when I was older, so I gotta have the second soon. And there is a reality of that pressure, but I like to take that off women as well. My specialty in women's hormones and fertility, I think that like 35 number just gets so stuck in our head, and to just take that pressure off if you have that time. That's nice to have. Then you have some more options of what maybe baby spacing would look like for you.
Feel like we're already talking about this, but what are some things to take into consideration when planning for birth control postpartum? Like, yes, we mentioned think about like what works for your family, but what are some other considerations?
Yeah, the big one people talk about is effect on milk supply. So I think often I'll kind of go over a few options of birth controls for postpartum. And most common I find with just in a circle of mom friends I'm in is the mini pill. And so that is a progestin only pill, opposed to the regular birth control pill is estrogen or a synthetic estrogen and progesterone. And so the difference is they say that shouldn't affect your milk supply as much. And they also recommend oftentimes doctors will say none of them will affect your milk supply. But when I've talked to a lot of women, when you're dealing with low milk supply, you will try anything to get it up. Most often, that was my experience. I also struggled with low milk supply, and I wasn't on a hormonal birth control. So it could happen even if you're not on a hormonal birth control. But that is something to keep in mind if you are real noticing like your breastfeeding journey was going great for those first 6 weeks, and then you start something at the 6 week visit. If you notice a difference, it can be that, even if they say it's safe for breastfeeding.
How soon after should a mama go on birth control or consider going on birth control? And I know that there are some moms that maybe will choose not to use a specific birth control, but maybe might use like a calendar or charting, which I feel like you
Mm-hmm.
mentioned that tends to be a little bit of your specialty as well. How soon should they go on something
Uh-huh.
and why?
Yeah, most often before you start having sex. So the 6 week thing is also like, I like to debunk that for new moms. Like, don't have that pressure. Communicate that with your partner. 6 weeks is not the magic number of when you will start having sex again. But before you start having sex, that is when you need to start something, whether that is, yeah, getting an IUD or starting a pill. And they say for the pill to be on it for like a week before trusting it as your birth control method. You can be using condoms as backup. I love condoms. I like reminding people that condoms are a great option postpartum. Like, I feel like we just disregard them now because we have other options, but they are still a great option postpartum if you're like, I don't want to jump into anything right now. Or like my method that I teach, the fertility awareness method, it's a little tricky postpartum. I'm actually working on creating an add-on course. I have two courses, one for charting for birth control, one charting to conceive. And at the beginning of next year, I'm hoping to release a charting postpartum add-on to my course, and that will really help clarify those cervical fluid. It's just harder to chart when you're not having a menstrual cycle, when you're not having a period and ovulation, but it's important to catch that first ovulation. So that's why I'm creating that, to help women, because it's totally possible. I charted during my postpartum for birth control, and I use condoms during my fertile phase. So that's how the method I teach works: is you identify your exact fertile phase, and it's different than the calendar method or the rhythm method because you are actually pinpointing ovulation. Even if it moves, you will know that based on your cervical fluid and your temperature. And so that's why it's 99.6% effective as birth control. If you are abstaining during your fertile phase, and then personally use condoms during my fertile phase, and a lot of my clients do too, and then the effectiveness rate is 98% with condoms.
I'm also really glad that you mentioned how, yes, our menstrual cycle is not like regular postpartum and
Mm-hmm.
you don't know when it's going to return. So, yes, it's so much harder to really be able to like follow a calendar, even if
Mm-hmm.
like,
Yeah, I do not recommend the calendar method or your app. Yeah, it's very popular, but the problem with it is, like, for my cycle, you can be very regular, but I swear, like, once a year, my ovulation's delayed like 10 days. And that's like, oh, I would have been pregnant if I hadn't been actually charting my fertility biomarkers of cervical fluid and temperature. So it just depends how serious you are about not getting pregnant.
generally speaking, when is a good time to consider to plan for your next baby? Hi, everyone. It's your host, Mariella. I wanted to thank you for listening and share some ways to show your continued support. You can rate and review on Apple Podcasts or Spotify. Share the show with friends and family. Buy me a coffee to help with the financial cost of running a podcast. Follow me on Instagram at Mama Wears Athleisure. And finally, subscribe to my newsletter. Thank you for listening.
The general recommendation right now is to wait 18 months before getting pregnant again. Of course, it's really just personal decision. I think that's just more for your body to recuperate, just the general recommendation, but it all depends on the family. And yeah, I think personally, I felt physically like I feel like I could handle another pregnancy, another baby around that 18-month mark, which is funny that that's what they recommend. But I think I mentioned my two moves. I forgot to mention I had a lot of business goals and that I wanted to finally get back to because I feel like I did not get back to work. I work for myself, but I did not get back to work as soon as I thought I would. And yeah, that was another big factor of wanting a little more time to when my son started daycare. And I was like, oh, I just want to work for like a year. It sounded wonderful to me. So before going on maternity leave again. So that was my personal choice. And a lot of moms too, with their like questioning, am I even gonna have a second? Like, am I just gonna be one and done and happy with that? And I think, yeah, like power to you, like that is a great choice as well. Or the other choice is just keep waiting if you're not ready yet, like, but you're not ready to make that final decision. I mean, if you think it'll work with your family to have 5 years gap or 6 years gap, there's no prescription of what a family should look like.
Yeah, and it is so different for everyone. Like every mom deciding when they want to. I feel like that 18-month mark is kind of like kids are so fun at that age that you're like, oh my gosh, I'm
Mm-hmm.
ready for another one. And sometimes I think that, but I'm like, oh no, no, no. I really just need like time to like be able to relax because right now we're go, 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 go. You sit
Mm-hmm.
down, and then next thing you know, your toddler pulled something out of a drawer, and you're like, oh, I gotta go pick that up. And so, yeah, it's definitely based on like the needs or what a mom wants. And what should a family consider when deciding to plan for their next child? Or even just mom, like
Yeah.
what should mom take into consideration?
Yeah, definitely the physical aspect of you like can your body healthfully carry another baby, another pregnancy, another birth? It's really demanding on our body nutrition wise, nutrients wise being sucked out of us. There's always going to be so many factors of like the financial, the work, the space. Oh, that's a big issue. I live in California and it's like it's too expensive to get a bigger house. And so there's just so many things to consider. But so many of my friends, they're making it work. They convert their master bed, their master closet into a baby's room, or they moved their office to the garage so they could have some more space. Like there's always ways to make things work, I feel like.
Definitely have to get creative or
Mm-hmm.
think small spaces, kind of like in
Yeah.
Europe, right?
Yes. Yes. Definitely.
Well, do you have any other tips, suggestions, or recommendations?
Yeah, my biggest one when on this topic is one of my favorite topics of talking about birth control is just that you have true informed consent on which option you're choosing. I think it's that 6 week visit has is lacking so much. You get so many visits while you're pregnant, prenatal visits, and one postpartum visit. I mean, maybe a few more if you've chosen a midwife, but it really feels like just like a birth control appointment. And even then it's really quick and they just assume like, oh, here's the mini pill. Oh, let's get your IUD in. They never ever, in my experience, have recommended the fertility awareness method, which I think is such a shame because I mean, they are medical doctors and they practice medicine. So they were going to recommend you a medicine. And so just knowing the true side effects. And so I mentioned milk supply, but there's so many other side effects that can also happen from birth control. And some women might start the same one they were on before and they were really happy with that birth control, but your body changes and you do not react the same way to all birth controls. And so it's really confusing in that 6 week time frame postpartum because postpartum depression, postpartum blues, like that's one of the biggest side effects of birth control is depression and low sex drive. And so it's just being aware that symptoms you may be experiencing, like it could be caused from that, even if your doctor denies it. And so just trusting your intuition, and not settling with negative side effects. Like there's other options out there. If you weren't happy with your IUD, you could either try the pill, or if you want nothing to do with hormonal birth controls, the copper IUD is a okay option. It's just also has a lot of other negative side effects that are hormone related, but very painful, causes a lot of inflammation. And again, just kind of big promoter of condoms postpartum too is a great choice. And then for charting your cycle postpartum, even though it's a little trickier postpartum, it's really, once you learn the basics of it, it isn't too hard. I believe charting your cycle is never too hard for women to understand. We are smart enough to know how our bodies work, and we deserve to know how our bodies work. So that's just really my big takeaway for people, is to find what works best for you and don't settle if you're not happy with it. So if you need another option, yeah, just know that fertility awareness method is also an option that can be strongly considered when you learn it correctly. And it just takes a little bit of upfront learning. So maybe with a brand new baby, that's a hard ask. So kind of be thinking about, if anybody's listening to this while pregnant, like what is your plan postpartum? Like making sure you can do a little bit of research on birth controls before you have a 6-week-old and have to make that decision. That's just a hard time. You're not getting enough sleep to make a true informed decision.
And your body really is not ready at 6 weeks. There's still so much, right? So many changes, and you're learning who you are. And yeah, that postpartum like recovery, it's so different for everyone. So yeah, 6 weeks really is just like, or even the 8 weeks, just not enough time.
So just be thinking about it ahead of time, and yeah, to be talking about it with more people. I think that's great that you have this podcast, because yeah, I think birth control's not talked about enough, and just all the different options.
Well, thank you so much. I appreciate you taking time and sharing all of this.
Yeah, definitely. I'm going to create a discount code too for your listeners. And so you can add that to the show notes, I'm sure, for my chart for birth control course, or my chart to conceive course as well, if you want to use that later. And then soon my postpartum add-on in the beginning of 2024. And yeah, it's just like a 3-hour video course, and included in it is a one-on-one with me to review your charts, because that's really where you get the confidence in charting, is when you can review your charts with somebody, and I take all the guesswork out of it, so that you can confidently answer the question every day, like, am I fertile today or not? For all my clients, I guarantee you can answer that question every day with confidence. And that's really the difference of just trying to learn it on your own, or just trying to use an app. Yeah, that confidence factor is big. And effectiveness. And that's what you get when you work with an instructor, is confidence and higher effectiveness rate.
Great. So that code will be in the show notes for anyone that wants to head over to your site and purchase any of those.
Awesome. Thanks so much.
Thank you. Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts, and give us a review if you like us.